All right, good afternoon. My name is Dr. Caitlin Happer. I'm a clinical assistant professor and licensed clinical psychologist at the NYU Child Study Center. And today we're going to be talking about navigating the holidays and winter blues for kids and teens with depression. I invite people to send questions as the webinar goes. If something pops up as I'm going along, we'll also leave some time at the end to discuss questions that might not have gotten answered along the way. All right, taking a look at our overview today, we're going to talk a little bit about child and adolescent depression, specifically focusing on some of the ways that it might be different from our kind of classic presentation of adult depression that a lot of us might be thinking of. We're going to talk specifically about some winter and holiday factors that might exacerbate symptoms of depression for youth. Talk a little bit about when to seek help, kind of differentiating between what is normative sadness or mood changes and what is warranting extra assessment or treatment. Talk a lot about how parents can support their children, and then lastly, do a little bit of an overview of treatment before getting to questions at the end. All right, so talking a little bit about child and adolescent depression. So we know that, unfortunately, child and adolescent depression has been on the rise for the past 15 years or so. So we saw that rates in about 2009 were about 8%, and before the pandemic started, so in 2019, they were already up to 15.8%. And we know that prior to the pandemic, they ranged from around 11% to 18.1% of youth were experiencing clinical depression, with about 65% of adolescents reporting some sort of depressive symptoms. During the pandemic, we saw an even sharper increase in depressive symptoms, which a lot of us have probably experienced ourselves or witnessed in others around us or our children. And so we saw that the prevalence rate of clinically elevated depressive symptoms rose to 25.2% during the COVID-19 pandemic for youth. So we see that this is a huge problem that is kind of only getting worse, and we want to make sure that we have some good solid strategies for how to address it for our children and teens. We know that in general, rates of depression increase into adolescence. So it is something that we do see in younger kids, but we do see an increase in adolescents with a sharper increase for girls compared to boys. Thinking about some developmental variants of major depressive disorder or other depressive disorders. So in children, we're more likely to see symptoms of anxiety. So you might see things like phobias, separation anxiety, and a lot of somatic complaints. So kids who are complaining about having headaches, having stomach aches, their throat hurts, things like that, and there's no kind of medical cause for it. That's something that we see more often in youth children with depression. We also see that their dysphoria is a lot of times expressed as temper tantrums and behavioral problems. So a young kiddo is less likely to sit there and look kind of like Eeyore and say they're feeling so sad. They might, but it's a less common presentation. And what we might see instead is more of that irritability, which becomes kind of temper tantrums and behavioral problems. So if you have all of a sudden a sharp increase in your child never had behavioral problems, but now all of a sudden they do, they're throwing a lot of temper tantrums, they're having trouble regulating their emotions and their behavior, that might be a sign that a mood disorder is underlying. There could be other things going on as well, but it's something to watch out for. We see that in general, we see fewer delusions in children, and we see fewer serious suicide attempts. So although younger children can experience suicidal ideation and can experience to the point where they might make a suicide attempt, it's less common in youth compared to teens. And by middle childhood, we can see that preoccupations with the concept of death, things like lowered self-esteem, social withdrawal and rejection, and poor school performance might start emerging for a kiddo who's dealing with depression. In adolescence, this is a huge point of change for our brains and for our development. And so we see some changes in depression as well. So we see there's a lot more cognitive components to depression for teens compared to youth. So they'll be thinking a lot more negative thoughts, including suicidal thoughts. They'll be thinking things about kind of like feeling hopeless about their future, feeling negative about themselves, about the world, about others around them. We also see more sleep and appetite disturbances. So again, looking out for if a teen is all of a sudden, sleeping a lot more than usual or not sleeping at all. I know that's kind of hard to tell because our teens are not sleeping enough in general, but that would be something, a change would be something to watch out for, as well as an appetite. So again, either overeating or undereating. So any marked change could be a sign of something going on. We see more kind of delusional thoughts in teens compared to younger kiddos. And we also see more suicidal ideation and attempts. But compared to adults, we still see for both teens and young kids that there are more behavioral problems and fewer of what we call neurovegetative difficulties. So with an adult with depression, you might see kind of think about that classic Eeyore presentation, very sad, very withdrawn. maybe very, kind of like moving around less, kind of isolated. You're not going to see that as much with kids and teens. We're also going to see a lot more irritability in youth compared to adults. So that's a big one. That's actually the only marker that is different when it comes to our diagnostic criteria, is that for children and teens, that concept of there being a lot of irritability, a marked increase in irritability, again, hard to differentiate from what we might think of as normative mood changes in childhood and adolescence, but that can be a sign of depression going on. I want to talk a little bit about some misconceptions about depression in youth. And this is pulled from both myself and my colleagues, some of the common misconceptions that we hear, especially from parents about their teens and kids, that kind of they'll say, well, there can't be depression because of XYZ. So the first one is I hear them laughing in their friends with their room, so they can't be depressed, right? I hear them being happy. And something to keep in mind is that although depression is something that we're looking for as being pervasive over time, there will be variations in mood across time. So if you hear your teen in their room on a game or on a FaceTime call with their friends and they're laughing and if they seem to be having a good time, that doesn't mean that they might not be suffering from depression. It could be that in that moment they are feeling more engaged, their mood has lifted because of the activity they're engaging in. It could also be that they're masking their symptoms, right? So especially when we get to middle childhood and teens, they can be really good about kind of hiding the symptoms that they're experiencing and putting on a show, putting on a front of how they're doing. The same way we might think about a high functioning depressed adult who, although they're depressed on the inside, on the outside, you might not know it. You say they're still doing everything they need to do. They're going to work. In this case, it'd be they're going to school, they're getting their schoolwork done, they're seeing their friends. They can still be depressed. Another one is my teen doesn't seem sad all the time, but he's always so irritable. So we talked about this a little bit, that irritability is a huge marker of depression in our youth. So that's something to really watch out for, is that we're not necessarily expecting our youth to appear sad, withdrawn, sullen. They might just be more irritable, a lot more outbursts, a lot more negative comments, things like that, and that could indicate depression. Third one, they only seem depressed about school. They just want to get out of doing work. So this can be a huge battle between youth, especially teens, I would say, and their parents when it comes to depression, is that often there is something that depression kind of targets on. It could be school, it could be friends, it could be an extracurricular activity. And so it can appear as if it's functioning to get them out of the thing that they don't want to be doing. In reality, most of us don't want to do the things that we don't want to do. And the reason that we're able to is because there's some sort of external motivator, right? So there's times where probably all of us wake up and think, I don't really want to go to work today, but we know that we have to because we need to keep our jobs. We have some obligations that we want to do, that we want to follow through with, things like that. If a teen is experiencing depression, that is going to, or youth is experiencing depression, that's going to make it harder for those external motivators to really have an impact on them. So they are going to be more likely to withdraw from the things that are primary stressors for them. So if your teen or your youth is depressed, seems only depressed about school, that doesn't necessarily mean that they're trying to get out of doing work. It just means that that is where their depression is kind of landing. Another one would be that nothing happened to them, so they can't be depressed, right? And I bolded that word happened, right? So nothing concrete happened. They didn't necessarily have a breakup. They didn't have a huge issue with their friends. Their parents aren't going through a divorce. Nobody died, right? And that's a huge misconception we have about depression, is that we often think about depression as occurring after something really bad has happened. And although that can be the case, depression can also come seemingly out of nowhere. It can be the result of these small, subtle shifts that are happening over time that result in a pattern of depression. So it's really important for us to recognize that even if nothing, quote unquote, happened, there can still be depression present for our youth. And I welcome anyone if they have any other kind of misconceptions that they have experienced, or that they're wondering, is this a misconception or is this true? You're welcome to throw that into the question and answer, and I can speak to it a little bit. So let's talk a little bit about why winter is so hard. So we know that there is, separate from kind of thinking about major depressive disorder or other depressive conditions, there is a seasonal affective disorder diagnosis, which is marked by increase in mood symptoms as the weather changes and the days get shorter, the weather gets colder, things like that. But in general, we see for depression more broadly that people tend to struggle more in winter than the summer. So the first thing is thinking about seasonal changes, right? So we all just went through daylight savings. I think we all can agree it's pretty unpleasant that the sun is setting by like 4:15 at night. It can lead to some really long evenings, especially when that sun sets and then you still have so much to do as a family, right? Your team still have activities to get to, your kids still have tutoring they need to go to, you still need to cook dinner, right? It can make it a little bit harder for the whole system. And there's long-standing associations with the winter months and increase in depressive symptoms. Some of those factors that we know are relevant include decreased sun exposure due to time changes and colder temperatures. So we do know that the increase or the impact of the sun can have an impact on our mood. So that decrease of vitamin D at that time outside can definitely mess with the hormones that kind of help regulate some of our mood related symptoms. We know that in general, one study showed that parents of teens rated depressive problems as significantly more severe in the fall and the winter compared to spring and summer. So this is something we kind of anecdotally all know about as a society, right? This idea that like it's harder in the winter in general, most people would say that. Although there are some people who love the cold, love the winter, which is wonderful, but in general, we struggle a little bit more. But we also see there's clear evidence that from parent report, we see that our teens are struggling more in the winter and the fall. In addition to the seasonal changes and the lack of sun exposure, we also have the holidays coming up, right? And although the holidays are typically one that we think of as adding cheer and happiness to our lives, there can come with a lot of stressors. So the first one is thinking about those family gatherings, right? So we're changing up a lot of routines for our kids and our teens when we have these family gatherings. They might be traveling, they're staying in a different location, sleep might be disrupted. There might be expectations that they are going to communicate with their cousins, with their aunts, with their uncles. There could be family stressors, right? There might be disagreements between, political disagreements on how they're living their lives, right? Just a lot of opinions coming around. So although family gatherings can be such a source of happiness and wonderful kind of connection, can also be a stressor for adults as well, but especially for our teens and our kiddos. And again, thinking about those logistical factors like the travel itself, the time away from friends. We know that in at the end of childhood and especially into adolescence, the kind of locus of where we hold our social value moves from the family system to the friend system. And evolutionarily, this makes sense. It has to do with changes in the brain that are helping our teens get ready to eventually launch off and start their own life. So they do need to be looking beyond their family system. And that can mean that they're really feeling like they're missing out if they in particular have to travel far away to see family when their friends are not. They're missing out on activities, things like that. And then they're also facing these changes. So that can be a source of stress. The other one is thinking about gift giving and receiving. So that can be a challenging thing, right? We know that there are things like disappointment about gifts that you wanted, but maybe you didn't get. There could be pressure that you're giving the right gifts. Are you getting what you wanted? Are you being grateful enough, right? So just this idea of, again, gift giving is meant to be something that is provides happiness and joy to our life, but it can be something that adds this added stressor for everybody, including our kids and our teens. And the last one is thinking about religious obligations. So the holidays can come with religious activities. And we know that in later childhood, and especially again in adolescence, there might be a breaking away from their religious observances. They might stop kind of dutifully going to church or to synagogue the way they might be, and they might start expressing their own concerns or questions about what does it mean to be involved in this religion? How do I feel about this? Does it actually fit in my goals with my values? And so having this time of year where there are going to be some religious obligations for some families, that can be another challenge for our kids. So those are some specific holiday stressors. And then the last thing is thinking about academics. So although academics can be challenging all year round, particularly from September to May, this time of year, especially for middle and high schoolers, can be really challenging. And that's especially true for seniors applying for college, right? So for those of us who might have seniors or older teens who are thinking about the college process, right now is when they have maybe submitted some of their early applications. They're getting ready to submit the rest of them. It's really crunch time with their essays, last minute SATs, things like that. It can be a high stress period. So adding that all together, that the sun is out less, it's less activities, it's colder, we have these holiday things coming up, I need to remember to get presents, I'm traveling to my great aunt's house in Ohio, whatever it is, and also, oh shoot, I have to get my college applications in. It can kind of be the perfect storm for making the winter a really tough time for our teens and our youth. So thinking about some signs of depression and how do we differentiate that from normal sadness? We know that feeling sadness is a normative part of childhood, adolescence, and adulthood. So we don't want to over pathologize someone feeling sad or someone having some of these symptoms. But when we think about the symptoms in whole, we want to think about things that the first and foremost that we think about is sad mood, but kind of jumping over that second column, remembering that for kids and teens, that can sometimes come across as more irritable and cranky, less of that traditional Eeyore sadness. We also want to look for behavioral changes. So are our kids withdrawing from their friends and family? And that might be a little bit hard to see because again, we think about teens as coming home. I don't want to tell you about my day, right? Going into their room. And to some degree that can be normative. So we really want to think about, is it a change? Is this a teen who typically would come home and talk to us about what's going on, but now they say they don't want to? Is this a kid who would normally be asking, can they go see their friend? Can they go make this play date? And now they're not, they just want to sit around, they don't want to do anything. Are they also disengaging from previously enjoyed activities? So you want to think about, what are these things that my kid finds enjoyable? And does it seem like they just don't enjoy doing them anymore? Do they feel bored? Does it seem like they're doing them out of obligation? Again, this can be challenging because kids and teens do hop from thing to thing, right? And again, that trying to figure out their place in the world, figure out what they're interested in can be really normal. But we want to see, especially if these things are happening at the same time, they're withdrawing from activities, they're withdrawing from friends and families, that can be a sign that something's going on. Again, we want to think about those changes in sleep and kind of excessive fatigue. Once again, really challenging, especially with our teens, but is it an increase from what it used to be? Are we feeling like they're constantly falling asleep? They're constantly feeling tired and down? That could be a problem. That might also come along with moving or talking more slowly. So if you just notice that your child has like less pep than they normally do, that could be a sign that something's going on. And particularly for kiddos, we might see that they might complain about feeling bored all the time, right? So a child is not going to be able to say to you, previously loved playing Legos, but now it's really challenging. I don't know. I just don't find interest in it anymore. It's not doing it for me, right? They're not going to say that. Instead, they're just going to constantly tell us, I'm bored. I'm bored. I'm bored. No, that's not fun. I don't like doing that, right? So that could be a sign, especially for our younger kids, of that, what we would call anhedonia, or lack of interest in things that were previously engaging. Outbursts that seem excessive to the situation. So again, if we just see this like higher level of emotionality, more challenges with regulating their emotions, things seem to really get to them more than they did before, that could be a sign that there's an underlying mood problem going on. Of course, some of the scarier ones that we want to look out for is thoughts of death, hurting ourselves, or thinking about, having ideation towards wanting to die. And I know for parents and for most adults, that's one of the scariest things to think about for our kids and our teens. And so it's really important that if that's going on, we're seeking help. We're going to talk a little bit more about when would you seek help versus not, but that would be one of those times that you would definitely want to seek out some help if you have reason to believe, either because they're telling you or you see evidence of it, that your child or teen is having thoughts about their death, right? So it's normative for kids and teens and adults, again, to kind of ponder about the meaning of life. What does it mean with death, especially as kids, something did happen, they lost a relative, and so they're thinking about, well, what is death? What does that mean to me? But if they're thinking about hurting themselves or thinking about wanting their own life to end, that would definitely be a time to get support. We might see an increase in self-criticism. So that could be like, they're just constantly saying, no, I didn't do well enough. I really suck at this, right? Really, really pessimistic kind of thoughts about themselves. That can be a sign of an underlying mood kind of cognition going on. Seeing a significant drop in grades or school motivation, especially for our kids who might feel really motivated. And we usually think of them as a kind of go-getter, a self-starter with school. If that starts to drop away, that can be a problem. More drug or alcohol use with our teens. We don't want to watch out for that. Again, it's hard to tell what is normative versus not, but if you notice that your teen is engaging in use that feels excessive, doesn't seem like normative teen development, it seems like they're using it to cope, that would be a big problem. Caring less about consequences. So especially if you have a kid or a teen who like previously really cared about kind of what you thought or what your reactions were to things, and instead they're just kind of like, I don't care, right? And then increased tendency to shut down when asked about their lives. So again, all of these things, the challenge is that these could be normative symptoms of growing up. But when you put them all together, if you're thinking about multiple, if you can say, thinking about my teen or my kid, I see multiple of these going on, it's a change from baseline, that can be a problem. And when we're thinking about kind of, is this just sad mood or is this some sort of disorder, we want to look for these factors on the side here. So the first thing is we want to think about interference. So are these symptoms getting in the way of them doing the things that they need or want to be doing in their lives? Are they not socializing as much? Is it disrupting their academics? Is it disrupting their home life, their hobbies? That would be a sign that it's a little bit more problematic than just a passing sad mood. We also want to think about avoidance. So are they avoiding the things that are stressing them out? Are they avoiding the activities that are harder for them? Are they avoiding talking about things, right? So a normative sad mood, you might think that if your kid is one who talks to you, they would talk to you about how they're feeling. But if they're just avoiding that completely, they just don't want to engage, that could be a little bit of a marker that this is more than just a passing sad mood. We also want to think about the level of distress. Do they seem really distressed, right? And that can be a little bit hard to tell because, again, kids and teens can be so they're volatile in some ways with their moods, but we want to think about, like, over time, do they seem distressed? Or one thing to watch out for is, do I as the parent feel really distressed about how they're presenting? right? We want to keep in mind that, of course, our interpretation of our teens and our kids is going to be filtered through how we are doing. So we want to keep that in mind. And if we notice that we are feeling really distressed about what's going on with our kid, it could be a sign that this is something more. And then we also want to think about duration, right? So we want to think about how long has this been going on? If my kid seems sad, a little bit down, cranky, they don't want to see their friend, but it's been a day or two, that's not going to be the same picture as it's been weeks and they've kind of slowly been withdrawing from everything. So we want to think about these factors of interference, avoidant, distress, and duration when determining whether or not this is kind of normative sadness versus something that requires a little bit more intervention. How parents can help, right? But this is the big one. And it can be hard when you see that your teen or your child is struggling and you're just not sure what to do. So the first one is to seek professional help if you're concerned that your teen has depression. So of course, at the Child Study Center, we have services that can help, but even talking with your pediatrician or anyone else that's kind of part of your child's care team can help you determine whether or not this kind of flags up to the next level if they need to get an evaluation from a more specialized mental health professional. We also want to provide validation about how difficult this time is and what they're struggling with. So I'm going to talk about validation a little bit more, but that's going to be a key one. We want to provide support for treatment goals when possible. So if your youth is in treatment for depression or for a mood-related disorder, we want to be thinking about, are we communicating with their therapist? Are we talking about, how we can help with these activities? How can we help with these goals? That's going to be really important. And then we want to identify and praise behaviors that are steps in the right direction. So if your youth, for example, is withdrawing, they don't want to leave their room. When they do leave their room, it might be tempting to say something like, oh, glad to see you. You finally decided to join us. Oh, we've been asking you for days to come down, right? Making those types of comments. And maybe that is a way that interacting with your teen or your youth worked before, but we want to be careful that we're not inadvertently punishing the things that we want to see. So we'd really want to kind of focus on saying things like, I'm so glad to see you. I'm so glad that you're here. Let's do something fun, right? So really making sure that we are praising the things that they're doing in the right direction. So validation, I really love this kind of cartoon up at the top, right? So when you suffer from depression and someone just tells you to cheer up, sitting his head and saying, my goodness, what an idea. Why didn't I think about that? So when we think about validation, what that means is to communicate to your child or teen that their feelings make sense in a particular situation. Their feelings make sense. It doesn't mean that you like it, you like their behavior, you agree with their choices, you approve of what they're doing. It means that you understand, or you're trying to understand where that person is coming from. So you might sit and say, well, I can't imagine like feeling that way. I don't know. But you might say for them, wow, it sounds really tough. I'm listening to you, right? Listening is the first step of validation. So they're just saying, I don't know. I just used to care about school and now I just don't care. And I just don't want to go and I just don't want to see my friends. Instead of saying something like, oh, but you love your friends and you've always done so well at school, right? Trying to convince them out of it. Sit with them and say, I hear you. That sounds really tough. That sounds like that'd be really distressing to just not care about something that you previously cared about. That would be an example of validation. We also want to try to avoid using toxic positivity, right? So again, that idea of like really cheerleading to maybe an extreme, right? Where we're kind of saying like, everything's good. We have to look on the bright side. It's the holidays. Let's think about the good things. Let's think about what we're grateful for, right? All of those things can have a wonderful place, but when they're done in the absence of validation and when they're done not in collaboration, but with the person, but as trying to kind of convince the person of something, it can come across as what we would call toxic positivity. And then we want to, or as our teams love to say, gaslighting. And we also want to avoid invalidating by pushing treatment strategies on them or trying to convince them that it's easy. So if your teen or your child is working with a therapist on something like behavioral activation that we'll talk about in a second, we want to make sure that we are working collaboratively with them. We're not pushing them to do those things. And that can be really tough because as parents, all we want to do is fix what's going on for our children, right? That's all we want. If we see them struggling, we just want to fix it. But it's important for us to recognize that in order to fix it, we have to be on their team, not the one pushing them to do things. All right, a little bit on treatment. So this is going to be a quick, broad overview of what can be very, very nuanced. But the first one that, especially for teens, but even for our older kiddos, the first line of treatment that has a lot of evidence base behind it is something called behavioral activation. It's probably something that you guys have thought about before, have experience with yourself, of just like doing things that activate you or make you feel good, right? So we want to be careful again of that, not that we're not invalidating them by making it seem like that's so easy. Like, oh, just go see your friends, or just go for a run. Endorphins are good, they'll make you happy, right? Or you just need to do something fun and then you'll get out of it, right? But that is the concept, is for a teen to understand that when they're feeling sad or they're having depressive symptoms, they disengage from the things that were previously activating for them. And so we really want to get them back in a pattern of reactivating in their lives so that they have the opportunity, not the guarantee, but the opportunity that they will feel better. And then we can kind of turn the cycle around. We also want to think about, from a cognitive behavioral therapy, they're going to learn things like coping skills. How do we relax so our intense feelings can kind of pass through us? Thinking about cognitive challenging, how can we challenge some of those negative thoughts and things like that. We'll also work with parents to increase parental and environmental support. That might mean working on validation, or it might mean working on some logistical things. Maybe there's something the teen really wants to be doing or the kid wants to be doing. And so we'll work with the parents to how can we make this happen if it's feasible so that they can get back into this groove. And then, of course, when cases get to a point where the symptoms are so high, we'll think about a medication referral. So one thing that we know from the research is that for low to moderate levels of depression, CBT alone has been shown to be effective for treatment. But once you get to the moderate to severe range, it's a combination of a psychotherapy like CBT and medication that is really the most effective. So that would be, if we're seeing more severe symptoms, that might be recommended right off the bat. All right, that leaves us a little bit of time for questions. We have 2 already in the chat, but I'm curious if anyone else has one. You can throw them into the Q&A box, or you can send them to us. I'll start with the ones that we have here. So the first one is how to address depression when a child is in denial or refusing to discuss their feelings. And I think that this is a really excellent question, because it's so hard when the person that you want to help doesn't seem like they want to be helped in the moment. So there's a couple of different ways, not knowing specifics about this situation, that we might go about this. So I think one is just getting the child into support, right? So can we leverage just, okay, let's go meet with someone 1 or 2 times. Let's talk about how you're doing. Let's talk about if you even agree that you think this is what's happening. And a lot of times when I'm meeting with teens or older children to do behavioral activation, that's what we're starting with. We're coming to a common understanding of like, is this depression? Is this what's going on? Because the same misconceptions that we as parents have, a lot of times kids and teens will have. So they might say, well, I don't just feel so sad all the time. I just feel kind of irritable. I don't think this is depression. I think everything's fine. I don't want to talk about it. And ultimately, we can't force them to talk about it. So in that situation, I would recommend for parents, if they're not even at the point of getting their teen into or their child into treatment, I would recommend that they just kind of keep themselves as an open door. So as much as you want to push, I would focus more on providing support, providing a lot of validation, and kind of a lot of times laying low and doing less, so that if and when your child is ready to talk to you about what's going on, that you are going to be someone that they want to come to. Whereas if every day you're saying, I think something's wrong, I think you're wrong, I think something's wrong, they're not going to want to come talk to you. Of course, caveat being that if you have concerns about severe signs of depression, any concerns of risk or safety, you're going to want to activate and get some support right away. The second question is, how can you help your child with activation if they don't feel like doing much because their agenda is filled with so much, like schoolwork or activities? This is a big one that comes up because, again, when we think about depression, we often think about someone who's doing absolutely nothing, right? They've stopped going to school, or they've stopped going to work, they've stopped doing activities. And so behavioral activation is, how do we get them back into it? But I would say maybe not just as often, but pretty often we'll actually work with a teen who they are overactivated. And so that's why something like behavioral activation is not as simple as just, oh, do more things, or do things that make you happy, or do exercise related things. It's actually about reevaluating, saying, what is this child or this teen's values and goals? And what will be, the term we'll sometimes use is, what will be an antidepressant activity for this youth? And that might mean restructuring things. Obviously, we can't get rid of school obligations altogether, but are we having them in extra tutoring and extra this and extra that we could maybe pull back on temporarily? Could we talk with the school about coming up with some sort of system so that they can feel like they have time to do other things in their lives? Could we recognize that actually this extracurricular activity they're in isn't really what's doing it for them, and actually they really want to try something else, and could we try that out and see if that has an impact on their mood? So in that kind of situation, it would be about rearranging what that child is spending their time doing, rather than just adding more, because more is often not the answer. All right, give a minute. We're at time now. If any other questions come up, please feel free to throw them in the chat now or the Q&A now. But otherwise, if it looks like we have no more questions, so on behalf of the Department of Child and Adolescent Psychiatry, I want to thank you for joining us today. You can find a full list of our upcoming webinars as well as recordings of previous webinars by going to our website, nyulangone.org/CSE webinars. Thank you again. Have a good one.